Section 3. By the end of this section, you will have knowledge of what we need in order to mobilise and develop the network further. So Tara, what is required to resource this network?
Well, we've identified key clinicians through our mental health and specialist services who will form part of the DBT training group. We've also commissioned DBT training to allow us to increase this to a team of 16 core clinicians. All the clinicians working in other parts of the service, a proportion of their time per week will be dedicated to the network, which will support the network, but also people accessing the service who have complex trauma.
So what essential resources do you need?
Well, there are two parts to the network. There's the resource required for the core team of the clinicians and the support to develop the trauma-informed island. And then there's the resource to deliver the trauma-specific 3-phase intervention.
We've mentioned the development of the trauma-informed island. What resources will this require?
We've aligned ourselves with the NHS Scotland Skills and Knowledge Framework in order to provide 4 levels of training, from a public health initiative, introductory training to the community to understand about complex trauma, and to know how to signpost people to appropriate services. Level 2 training is a health and education initiative to enhance the awareness of complex trauma in GPs and other health professionals. The final 2 levels of training offer enhanced detail about trauma according to the level of clinical responsibility and the therapy input required. Training would be provided on a rolling programme by clinicians from the core network and a variety of community and healthcare settings.
What else would you require to resource the development of a trauma-informed island?
Well, Lucy, we also want to offer a step liaison facility whereby people book consultation slots offered by the core DBT team on a rolling basis, whereby anybody could book in if they had a concern about someone, say a pub landlord who had noticed that one of his clients was perhaps drinking too much or stopped taking care of himself, or the hairdresser whose client was looking more and more distressed or was perhaps missed appointments. The community plays a key role in people's lives and may often need support and information in how to direct people to appropriate services. The number of clinicians we need in the core team takes into account that they will have different roles at different times, and also aids our clinicians in having levels of intensity and work prevents burnout.
Mm-hmm. And would the core team also provide a similar service for people who have got clinical responsibility?
Yes, we'd like to improve the clinical supervision and governance available for clinicians working with complex trauma clients in health and community services or our stakeholder partners. We want to support their work, join together in more partnership working, and strengthen the network around people with complex trauma. In doing this, we'll be thinking about what services we can provide to make this happen. So we've described the support we would like to offer. Let's talk about essential roles that we've identified in order to be able to provide this.
So yes, Tara, so as you say, we need additional resources of clinicians to join our team in order to mobilise the network. So from the outset, we know that within our psychology and JTT services, we're seeing people with more complexity than the services were originally designed for. Now we have a team of skilled clinicians who are meeting this need, but as we know, it's had an impact on waiting lists. So people who have got more complex difficulties often require longer intervention times. Our aim is that by having access to this network and to resource it further, it will mean that we can have people who can have the right amount of therapy seen at the right time. So from our current indications, this would mean a 68% increase in the specialist psychology service clinical caseload, and this will form part of the core DBT team. So we're therefore asking for 2 full-time equivalent clinical or counselling psychologists to join the team and manage this increase in caseload. We've also identified other specialist gaps that will need filling.
So can you describe these specialist areas, Lucy?
Well, we've identified a gap in clinical psychology to be available at the probation and in prison services. Forensic psychology is currently available, but that's different to clinical therapeutic input. We know that this is significant for the network since there's a higher amount of trauma in people within prison populations. A recent study and meta-analysis done by Bayanai and colleagues in 2018 showed that there was a lifetime rates for PTSD were 18% in men and 40% in women within prison populations. We really need a service there. And this is why we're asking for one full-time equivalent, dual qualified forensic and clinical psychologist and one clinical or counselling psychologist with forensic experience to help to try to meet this gap.
So what other specialist areas have been identified, Lucy?
We recognise that there's a need for specialist clinical psychology within domestic violence and sexual health. Obviously, we've spoken a lot about this during our talk today and the importance of sexual health and sexual abuse. So we would like to be able to offer specialist interventions, consultation, guidance, clinical supervision and governance to our stakeholder partners and our partners within health and community services. We're therefore asking for one full-time equivalent counselling or clinical psychologist who's got specialist experience in domestic violence and sexual health. To help with our outreach and engagement programme, we're also offering to create 2 roles for community support liaison partners. So these would be people who could help to link the network with what's happening out there in the community and the team and vice versa to help to improve communication in both ways.
So aside from these specialist areas, what other key roles have been identified?
Well, we require 2 full-time assistants in administrative staff to join us. We know that engaging in services is difficult for the kind of people who are experiencing difficulties in joining this service. So it's really key that we have enough administrative resource to meet inquiries and to be able to facilitate communication both within and between services. So lastly, we have a unique opportunity here in Jersey to be really at the cusp of service evaluation and research. We've taken the time to engage with our community, our colleagues and our island in developing this network. We don't want this to end here. In the past, people have felt that they haven't been listened to. So we would like to evaluate this network from the start, and we will need 2 full-time assistant psychologists in order to help us to gather qualitative and quantitative information about how the network is working and to be able to evaluate this so that we stay in touch with developments that are happening worldwide in terms of trauma-informed care and trauma-specific services. So, in summary, Tara,
we are working to develop a trauma-informed island to improve the way we meet the needs of people with trauma experiences. We are part of a development and implementation team to design a complex trauma network with international guidelines and to engage with our colleagues in health and community, our stakeholder partners and voluntary sector, as well as the community themselves. We have a larger oversight group that helps us guide and make decisions that are practical and beneficial to meeting the recommendation 8.4 of the JCI. Going forward, we want to continue to evolve and engage people who have been part of the services and roles in engaging other people. As well as delivering a complex trauma interventions, we also want to increase awareness, knowledge and skills in the entire workforce to develop services that are trauma-informed, effective, efficient and person-centred.